I'm Dean Whiting, Pathology Technology Australia. Previously, you've heard me talking about managing the COVID infection using PCR testing, polymerase chain reaction testing, and rapid antigen testing. That lateral flow test that you can buy from the pharmacy or many other places, and that you can do yourself at home or in the workplace. Today, though, I wanted to talk a little bit about influenza. We've been very fortunate in Australia over the last couple of years that the rates of influenza infections have been extremely low. In fact, vanishingly low. I think less than one death in Australia in 13 or 14 months in the past year. However, with the reinstatement of international travel and with more communication with the Northern Hemisphere, people travelling to and from, the likelihood of influenza becoming quite an issue again this year is very real. In fact, we know already that in some states of Australia there have been more cases of influenza reported in the last few weeks than in the entire year last year. Now, influenza, whilst maybe not as high profile as COVID, still takes many, many lives and costs the economy in Australia many billions of dollars through lost work hours. So influenza is just as an important public health issue as COVID. The good news is there are tests for influenza, and they're the same tests as we have for COVID-19. There are PCR tests, polymerase chain reaction tests, and there are now starting to become on the market rapid antigen tests, those lateral flow tests. PCR tests will need to be done at a laboratory. You'll get the result back in 12 to 18 hours, and then you'll be able to take the appropriate action. Once the rapid antigen tests become available, you may also be able to use those in the workplace or at your local medical facility or healthcare provider. It's important that you know if you have flu for a couple of really key reasons. One, flu is highly transmissible, both within your family setting and in the workplace. So if you know you're infectious via a PCR or a rapid antigen test, you can take the appropriate actions. And they're the actions we've learned through COVID-19 about hand hygiene, about wearing a mask, and about isolating, socially isolating, so keeping your distance from people. That's the first reason. The second reason is that there are treatments available for both flu and, for that matter, for COVID, that if you get your diagnosis early, within 4 or 5 days, then there is reliable antiviral treatment available. Your doctor can prescribe that treatment based on your other health conditions, but that treatment can be very effective in reducing the hospitalization rate and the death rate associated with flu, and also, as it happens, with COVID. So there are important reasons why you should get tested. It's to prevent transmission to your loved ones and in the workplace. And it's also because you may find that there is an antiviral for your COVID or for your flu that are effective in minimizing the impacts of that virus for you. As always, you need to seek proper medical advice, seek the advice of your doctor before gaining access to these treatments. I hope that's been helpful. I'm Dean Whiting, Pathology Technology Australia.